Today we will cover food-borne diseases, food fortification, food adulteration, community nutrition programs, monitoring and evaluation of community nutrition program in this lecture. The term food-borne disease is defined as a disease, usually either infectious or toxic in nature, caused by agents that enter the body through the ingestion of food. Infective agents like bacteria, parasites, and viruses may be present in food, or there may be some toxic substances which are present in food. Globally, foodborne diseases are on increase. Various foodborne diseases are quite common in Pakistan. Foodborne diseases are classified broadly into foodborne intoxications and foodborne infections. Foodborne intoxications are further divided into four types. The first one is the diseases which occur due to naturally occurring toxins in some food, like lethaism and endemic ascites. The second type is the diseases which occur due to toxins produced by certain bacteria. The example of this type is botulism or staphylococcus infection. The third one is due to toxins produced by some fungi. Examples are aflatoxin, ergot, and fusarium toxins. The fourth and the last type include those foodborne diseases which are due to chemical poisoning. These diseases are due to heavy metals like mercury, cadmium, lead, or oils like petroleum derivatives and other solvents, and these are also due to migrant chemicals from packaged material or asbestos, pesticide residue like DDT residues or BHC residues. Foodborne infections are divided into bacterial diseases, viral diseases, and parasitic diseases. Bacterial diseases include typhoid and typhoid fever, salmonellosis, staphylococcus infections, Clostridium perfringens illness, botulism, Bacillus cereus, food poisoning, E. coli diarrhea, non-cholera vibrio illness, and other infections. Viral diseases include viral hepatitis and viral gastroenteritis. Parasitic diseases include teniasis, ascariasis, amoebiasis, and some other. The disease neuroletharism is caused by a toxin, beta-oxalyl aminoalanine, and it is a nervous disease of humans which is caused by excessive consumption of the pulse, Lathinus sativus, for prolonged periods. Another food toxicant is aflatoxin. Aflatoxins are a group of mycotoxins produced by certain fungi, for example, Aspergillus flavus and Aspergillus parasiticus. These fungi infest food grains such as groundnut, maize, parboiled rice, sorghum, wheat, rice, and cotton seeds under conditions of improper storage. If moist level is above 16% and temperature is between 11 to 37 degrees centigrade, these conditions favor toxin formation. These toxins are known to be hepatotoxins because aflatoxins has been detected in samples of breast milk and urine which are collected from children who suffer from infantile cirrhosis. So, research is going on and attempts are also being made to relate aflatoxins with human liver cirrhosis. Control and preventive measures of aflatoxin include proper storage of food grains after drying. Moisture content should be kept below 10%. Health education of population is necessary. If the food is contaminated, they must not consume food. Food grains such as bajra, rye, sorghum, and wheat may get infested by the ergot fungus. Consumption of ergot-infested grains lead to ergotism. The symptoms include nausea, repeated vomiting, giddiness, drowsiness after ingestion of ergotic grain. These symptoms are acute but rarely fatal. In chronic cases, painful cramps in limbs and peripheral gangrene due to vasoconstriction may result. Ergot-infested grains can be easily removed by floating them in 20% salt water. They can also be removed by hand picking or air flotation. The cause of epidemic dropsy is contamination of mustard oil with argemone oil. The symptoms of epidemic dropsy include sudden non-inflammatory bilateral swelling of legs, which is often associated with diarrhea, dyspnea, cardiac failure, and even death may follow. Some patients may develop glaucoma. Disease occur at all ages and mortality varies from 5 to 50%. The contamination of mustard or other oils with argemone oil may be accidental or deliberate. Two tests are applied for the detection of argemone oil, which are nitric acid test and paper chromatography test. The cause of endemic ascites is a millet, Panicum miliare, which gets contaminated with wheat seeds of Crotalaria. Seeds were found to contain alkaloids, which are hepatotoxins. And this disease is characterized by rapidly developing ascites and jaundice, and mortality is very high. An epidemic was reported in India with very high mortality. Preventive measures include health education of people not to consume the food which is contaminated, de-weeding, and simple sieving of the millet to remove the seeds. Fusarium species of field fungi are known to contaminate food crops like sorghum and rice and pose health hazard to livestock and man. Foodborne diseases we have already covered divided in the previous lectures: diseases, viral diseases, and parasitic diseases. Bacterial diseases include typhoid and typhoid fever, salmonellosis, staphylococcus infections, Clostridium perfringens illness, botulism, Bacillus cereus, food poisoning, E. coli diarrhea, non-cholera vibrio illness, and other infections. Viral diseases include viral hepatitis and viral gastroenteritis. Parasitic diseases include teniasis, ascariasis, amoebiasis, and some other. Additives are defined as non-nutritious substances which are added intentionally to food, generally in small quantity, and to improve its appearance, flavor, texture, or storage properties. In modern era, introduction of chemical additives is in practice. It is done to increase the shelf life of the food, improve its taste, and to change its texture or color. The use of food additives is subjected to government regulation throughout the world. The nature and quantity of additives shall be clearly printed on the label. The ultimate effects of food additives on man is an important problem of public health and is therefore of great concern to the public and the health administrators. Food additives are classified into two categories. The first category include coloring agents like saffron and turmeric, flavoring agents like vanilla essence, sweeteners like saccharin, preservatives like sorbic acid or sodium benzoate, acidity imparting agents like citric acid or acetic acid. The second category include contaminants incidental through packaging, processing, farming practices like insecticides, and environmental conditions. Preservatives prevent or slow down the growth of bacteria or fungi so that food can be kept longer. Flavoring agents add taste or fragrant smell to make food more edible. Stabilizer mixes two liquid that usually do not mix together and prevent the sediment process in liquid and provide a smooth and uniform texture. Coloring agent, as the name indicate, color food to make it look more attractive. Thickening agent thicken liquids such as soup or sauce. Antioxidants slow down the oxidation of fat in food and prevent oily or fatty food from becoming rancid. Food fortification is defined as a process whereby nutrients are added to food in relatively small quantities to maintain or improve the quality of diet of a group, of a community, or a population. The examples of food fortification include fluoridation of water as a preventive measure of dental caries, iodization of salt for combating the problem of endemic goiter. Food fortification is done in banaspati ghee or milk with vitamin A and D. Technology has been developed for the twin fortification of salt with iodine and iron. In order to qualify it suitable for fortification, the vehicle and the nutrient must fulfill certain criteria. The vehicle fortified must be consumed consistently as part of regular daily diet by the relevant section of the population or the total population. The amount of nutrient added must provide an effective supplement for low consumers of the vehicle without contributing a hazardous excess to high consumer. The addition of the nutrient should not cause it to undergo any noticeable change in taste, smell, appearance, or consistency. The cost of fortification must not raise the price of the food beyond the reach of population. Food adulteration is an age-old problem. It consists of a large number of practices, for example, mixing, substitution, concealing the quality, putting up decomposed food for sale, mix branding, or giving false label and addition of toxicant. Food adulteration is a legal offense, and when the food fails to meet the legal standards set by the government, it is said to have been adulterated. Adulteration results in two disadvantages for the consumer. First, he or she is paying more money for the foodstuff which is of lower quality. Secondly, some form of adulterations are injurious to health, even resulting in death. Here, some common forms of food adulterations are listed. For example, dried seeds of papaya are mixed in black pepper. Black gram husk is mixed in tea leaves, etc. Malnutrition is a serious issue in Pakistani society. During the past few years, many nutritional programs have been initiated or launched by the government and non-government organizations. Some of these programs focus on raising awareness among the masses, while others focus on either directly supplying nutrients to the people or fortification of the dietary components. These programs include Vitamin A Prophylaxis Program, prophylaxis against nutritional anemia, control of iodine deficiency disorders, school health program, the Tawana Pakistan project, micronutrient initiative, national program for family planning and primary health care, which include the nutrition component as well, Pakistan community management of acute malnutrition program. We have covered vitamin A prophylaxis program in the previous lectures. Just to remind you, one of the component of National Program for Control of Blindness is to administer a single massive dose of an oily preparation of vitamin A containing 200,000 international units orally to all preschool children in the community every 6 months. You have covered iodine deficiency disorders in detail. Iodine deficiency is a leading cause of mental impairment and therefore iodine offers protection to the growing brain. Supporting efforts to achieve universal salt iodization is strategy to help eliminate iodine deficiency disorders. Although the focus of this program is not exclusively nutritional, however, an important component of this program is the school nutrition program, which provides relevant nutritional information to the students and make healthy, balanced food available to students of the school which are located in poor areas. These programs run in the concept that nutritional interventions among children will not only benefit their health and education performance, but will also help spread awareness among their parents and relatives. The Tawana Pakistan project. The project is a government initiative of Ministry of Social Welfare and Special Education, and it is focused on primary school girls. It aims at combating malnutrition and increasing school enrollment among the girls in primary school in villages. It was launched by the Government of Pakistan between 2003 and 2005 in 4,035 girls' primary schools in the rural areas of the poorest districts of Pakistan. The aim of this program was to improve the nutritional status and school attendance of primary school girls. Micronutrient Initiative, briefly called as MI, works with the government and the UN to eliminate deficiencies of micronutrients such as iron, iodine, folic acid, vitamin A, and zinc. MI implies screening and identifies the areas which are deficient in micronutrients and donate vitamin A and zinc supplementation. It also provides its expertise to the government and trains the involved personnel for programs which are involved in salt iodization or floor fortification projects. National Program for Family Planning and Primary Health Care. This program was initiated by government in 1994 with the aim of providing primary health care services at the doorstep and improving the health conditions in rural areas. In addition to the health services, lady health workers also provide nutritional advice to the community and provide iron and folate supplementation to the pregnant women at the doorstep. Pakistan Community Management of Acute Malnutrition Program encompasses three components. First is early detection of children with severe acute malnutrition through community outreach and active case finding. Then the second one involves inpatient therapeutic care in a stabilization center for children with medically complicated severe acute malnutrition. The third and the last is outpatient therapeutic care for children with medically uncomplicated severe malnutrition. Monitoring and evaluation of nutrition programs are very essential element in the success of the program. Nutrition monitoring, evaluation, and feedback systems are essential in measuring program performance and evaluating the impact of interventions. Improvement of a family diet as a whole means improvement in the diet of young child in a poor family. Improvement in the economic condition of the community to a level at which families can afford balanced diet. These are the objectives or the ultimate aim. Monitoring and evaluation strategies and monitoring and evaluation uh, activities mainly focus on these objectives. The purpose of nutrition monitoring and evaluation program is to determine and measure the amount of progress made for the nutrition intervention and whether the nutrition related goals, objectives, and expected outcomes are being met. There are four primary ways a person can get micronutrients in their system. The first one is biofortification by eating foods that have been engineered to have greater amount of nutrients. The second is dietary diversity. It means eating a balanced diet. The third one is food fortification through the addition of micronutrients to already consumed staple products. The fourth one is supplementation, taking a vitamin tablet. WHO recommends 5 keys for food safety. Keep yourself clean, separate raw and cooked food, cook thoroughly, cook food at safe temperature, use safe water and raw material.